Hello, welcome to another video. As usual, long overdue. It's now late August, still seriously hot in Japan, very humid. I've got potentially bad news and also some good news. The bad news is that for the past 3 months, each of my monthly blood tests has shown potentially the recurrence of the cancer. I track a tumor marker or biomarker called CEA, and for the last 3 months it's been rising. It's still low. It's still like below the kind of scary threshold, but yeah, it's a little bit it's quite worrying really. So probably I need to do immunotherapy again quite soon. Really, I should do another round of immunotherapy anyway, because I'm in the third year of no evidence of disease. And if I can stop a recurrence happening for 3 years, then the chance of the cancer kind of coming back starts to drop quite dramatically. So it'd be really amazing and helpful if you could share my fundraising link, because I need to get some donations for crowdfunding. On a much more pleasant note, I'm putting together a course for cancer patients, and this is focused on cancer decision making, but also how cancer patients can protect themselves from kind of the scammers and crooks and quacks. When you have cancer, you get lots of messages from people trying to sell you various treatments, just people trying to make money. But you also get a lot of messages from just kind of crazy people who believe you can cure cancer with baking powder or green vegetable smoothies or whatever, or a whole bunch of other strange, weird and wonderful therapies. There's never any evidence for these, but yeah, you get kind of targeted a lot by crooks, crazy people, and also I guess well-meaning people who suggest things that they have heard or saw on the web. Why don't you try this magic pill or magic potion? Why don't you try this special therapy in Mexico? And there's never been any examples of these actually working. Never. Not at all. I know because I really wanted to believe some of this stuff would work, so I dug into it in quite a lot of depth. And I noticed the same kind of three red flags. So often someone claiming that they had treated their cancer with successfully with one of these crazy treatments, they'd often not ever been diagnosed with cancer. So maybe they had gone to some kind of alternative medicine therapist who said, "Oh, you've clearly got cancerous tumors in your body, and you need to buy this expensive Chinese tea, and it will cure the cancer and flush out your liver." Or another typical situation where maybe a genuine cancer patient, they would decide they had been cured. So they'd be diagnosed with cancer, maybe in a proper clinical setting, and then they would try some magical treatment, and then maybe they'd get a good blood test. They'd say, aha, my cancer is cured. Well, actually, for most cancers, you need 5 years of good blood tests and clear scans. And for a lot of cancers, it now seems that recurrence can occur after 5 years. For breast cancer, I think the current thinking is that 10 years is really the point where you can say you're probably cured. Hopefully in the future with more accurate testing, we'll be able to say someone is genuinely cancer free and it's not going to recur, or more accurately, they have no more chance of recurrence than anyone else has of getting cancer. And then the third and very common aspect to people promoting these kind of cures is that they neglect to mention they've had a lot of real treatment that works. So, for example, there's a quack on the web who, I think his website is Chris Cured Cancer or Chris Beat Cancer, something like that. And he had surgery, and he was recommended to have some chemotherapy, and he turned it down and instead had some green smoothies and a lot of praying and took some supplements or whatever. And now he's telling people that he cured his cancer through natural means. But of course, his surgery potentially has cured the cancer. I very much hope his cancer doesn't recur. He was recommended to do chemotherapy afterwards to lessen the chance of the cancer coming back. And he chose not to. But, early stage cancer, good surgery, a surgery where the surgeon is confident that he has got all the cancer out, hopefully your chance of recurrence is quite low. So those are kind of three of the things I found time and time again when people are promoting these treatments. Another problem we have as cancer patients is we've got to make very, very difficult decisions, often with incomplete, or always with incomplete information or bad quality information. So kind of comparing two poor quality studies for different drugs, trying to decide which one might help us, or maybe an oncologist has recommended a drug and they've explained possible side effects, and they say the drug potentially may help you, but the side effects are potentially very severe, and it's difficult for the oncologist to advise you what to do. So the course I'm making is all about that. So that's another reason why I'm crowdfunding again. So I'd be so grateful if you could share my fundraising link. So it's just matthewdons.org, and it's below this YouTube video. Another bit of potentially very good news is I recently had an online meeting with Dr. Lingbing Zhang, who is a cancer researcher in the US. He was at Stanford and now is doing a biotech company to try and get drugs to patients quickly who are in very late stage cancer. So this is where the doctor says you have a few months to live and you should write goodbye letters and sort out your will and that kind of thing. Dr. Lingbing Zhang is a researcher in something called cancer cachexia, which is like cancer starvation. We had a long online meeting, and he's really interested in doing some projects and working together. Although his focus is on late stage cancer, so his focus is maybe using pre-existing drugs and other treatments to help patients who are quickly losing weight, or are eating enough calories or getting enough calories on a drip, but are losing weight, and particularly losing skeletal muscle and losing heart muscle, and maybe losing some fat as well. And this is a very complex condition. Yeah, probably partly it's an immune system issue, which of course, yeah, is a big part of what cancer is. And Dr. Lingbing Zhang feels that, yeah, we could actually treat this successfully. About 30% of people who die of cancer, they die because of cancer cachexia. But also about 80% of cancer patients get some level of cancer cachexia, and often that stops them having cancer treatment, or they have to be on a reduced dose or longer breaks between chemo, that kind of thing. So I think it has the potential to save not just the 30% of cancer patients that die, but I mean, yeah, it could be a long way towards being able to cure all cancers, because, well, for a start, should mean that existing cancer treatments will work better for patients who otherwise, wouldn't be able to complete the course of their treatment, or yeah, would have to have a reduced dose or that kind of thing. If you are suffering from cancer starvation, then you wouldn't be able to do many surgeries. So yeah, very, very promising meeting. So yeah, we're exchanging some ideas, and I'll update you on yeah, how that's all going. But yeah, it's fantastic. He is a really, really committed scientist who cares deeply about helping people in the very late stages of cancer, people who up to now are essentially ignored by the medical systems. There's just this belief that nothing can be done to help them, try and keep them comfortable, try and reduce their pain, but that's it, game over. Dr. Lingbing Zhang thinks that doesn't have to be the case, and I strongly agree with that based on yeah, my studies and talking to lots of researchers and doctors in Japan. So yeah, that's very exciting. But yeah, if you could please share my fundraising link, matthewdons.org. That's matthewdons.org. If you could share it on social media, make a donation if you're able to as well, that's obviously fantastic. Then I'll be able to have another round of immunotherapy, and I'll be able to continue doing what I can to support other patients. Yeah, running an online group for mainly terminal patients who are trying to come to Japan for potentially life-saving treatment. And of course, I've got the cancer course that I'm working on at the moment, and I'll let you know how that progresses as well. But thank you so much for your interest and support. Yeah, I appreciate it massively. And yeah, please share the link, and please comment on the video if you can. Thanks a lot. Goodbye.